Hi, Dr. Kandwala from Advanced Urogynecology of Michigan. Today we'll talk about the different types of prolapse and why it's so important to understand these different prolapse types. Now, there'll be some graphic pictures in this video, but it's very important for you to understand that this is not rare. I see this very frequently, if not every week. So this is the normal anatomy. You have the bladder, urethra, the vagina, the uterus, and the rectum at the back. It's nicely supported. Nothing is falling out. But then when there's a bladder prolapse or the front wall prolapse, you can see it's coming down the bladder and it's coming outside, as you can see right here. So this is a classic bladder prolapse. This is a large cystocele that's coming outside the vagina. And again, not uncommon to see this. Uterine prolapse, as you can see, the uterus is moving down and now the uterus is completely outside the vaginal opening as showed here too. This is the cervix, this is the uterus, which is completely coming out of her body. From the back wall of the rectocele is where the rectum is bulging forwards towards the vagina. So it's coming out of the anus, but it's bulging towards the vagina. It can't break through because you still have the vaginal and the rectal wall, but it's protruding there. And the stools are trying to sometimes go this way, but they have to basically go back. So this is a bothersome rectocele, and an anorocele is typically seen in a patient who's had a hysterectomy, where the top of the vagina starts coming down because there's no uterus now, and you have the small bowel hernia. So the rectocele is the large bowel hernia. This is the small bowel hernia. Now, sometimes we may get a small bowel hernia and a large bowel hernia at the same time. So as you can see right here, this is the combination. This starts right at the opening of the vagina. This is the back wall of the vagina, which is falling out. And you have the top part is the small bowel hernia. The lower part is the large bowel hernia. So what are the prolapse symptoms? Remember, the most common and the most important symptom that I always want to hear from my patients is that I feel a bulge. I feel a bulge. I don't like it. It's coming outside. I was just showering and I touched that and I would feel something protruding. And I saw with the mirror and I just did not like what I saw. It was not there before. And that is what I count on. It should not be anything else like, oh, my bladder is not emptying. That is later on, but the main thing is that she can feel the bulge. The bladder symptom that can happen, as I was mentioning, is difficulty emptying the bladder. So here, if you see the urethra, the tube is kinked, the bladder is down. And if it is down, it is hard for the urine to come up the hill and turn the bend and come out. And that's why many women find it difficult in emptying. So the urine could be slow in stream, and then they have increased urgency, frequency, and especially at night. Why? Because at night when you lie down, the bladder goes inside and then she has to go very frequently. If there is retention and stagnant urine just sitting here, it can cause bladder infections. And sometimes there's also urine leakage with urgency because now she's getting a little bit bothered. The bladder is getting bothered, irritated by this infection and the stagnant urine. Wants to kick it out, and you can get urgency. And there's another condition called occult stress incontinence that I'll describe. So as you can see right here, I was talking about urethral kinking and the bladder coming down. That's what you see. So when urethra is kinked, if she coughs, the kink just gets worse because the bladder is falling this way. So she's unlikely to leak when she is coughing. However, when the bladder is pushed and put back in, then the urethra becomes straight, she will leak. That is called hidden urine leakage. Bowel prolapse, which is the rectum bulging into the vagina, as you can see here. Now, the stools typically should come straight out from here, but they will go up here, get hung up at this cul-de-sac, and now she has this terminal constipation. And she will tell me that, I sit at the toilet seat, I'm pushing, and I see this bulge coming forward, and I just cannot evacuate my rectum until I actually put my finger in the vagina, push this back at the perineum, or sometimes they have to digitate the rectum. They put a finger in the rectum and pull the stools out if they're very constipated. It's a headache, and women don't want to deal with this and want this to be corrected. And because of this thing, it can also weaken the sphincter and can cause stool leakage. Next, we'll talk about something important, and that is, did you know that an improperly done exam can miss a type of prolapse and can lead to misdiagnosis and possible failure. So we shall discuss the importance of doing a proper, thorough examination and you providing me with the complete history forms so I will know what medications you are and what comorbidities you have, what your goals and expectations are so that we can meet them. So I'll see you in a bit. Thank you.